Hello, students. This is your review for Health Test 1 from page 55 through 78. I encourage you to take out a piece of paper and a pencil and write them down. Go to the source and find the answer. 20 seconds. What is it that I need to do for 20 seconds? Or I should do. I need a bigger table. Okay, so 20 seconds. Yeah, that's a little bit better. Okay, 20 seconds. Next one, modern medicine. What did modern medicine discover? Who discovered modern medicine? Or who's credited with modern medicine? Number 3, the more nutrients they lose. Something happens to food when this happens. The longer this happens, the more nutrients they lose. They lose nutrients when this happens. Number 4, brush your teeth for 1 minute at least blank daily. How many times a day should we brush our teeth? At least. Number 5, method used for minor injuries, and they have the initials RICE. What does each initial stands for? What requires a visit to the doctor? What requires a visit to the doctor? Next one, number 7. These are the functions of your teeth. There's one that is for grinding food. There's one that is for tearing and crushing. There's one that you bite and cut food with. There's another one that tears apart coarse fruits, vegetables, and meats. Which tooth? Store cooked food in. Where should I store cooked food? How long can I leave it out? What is the Heimlich maneuver? When should I use it? When shouldn't I use it? What is CPR? What does the letter stand for? How do I know that my wound is infected? It has 3 characteristics. Pause the video so you could write. Last part, vocabulary. You need to know. What are vitamins? What are primary teeth? What is plaque? What are permanent teeth? What is an optometrist and why do I go to him or her? Which I need to go. First aid. What is first aid? When do I administer first aid? Diagnosis. What is it? Dentist. Cuspids and cavity. Okay. So all of that you need to know for your quiz. And the last section of health that we need to read, first aid, the help that is given immediately after someone has been hurt. Minor injuries, injuries that do not require an immediate doctor's visit. First aid emergencies, injuries that require an immediate doctor visit. Heimlich maneuver, pulling in and up on the abdomen to remove an object that causes choking. First aid, you are reading with me. We are reading from page 74 to page 75. To page 78. From page 74 to page 78. You are reading along. Please have paper and pencil so you can write down information. Always taking notes. The better notes you take, the better student you are. The better you do on your exams and tests. First aid to the rescue. When someone gets hurt, it is important to know what to do to help. Doing the wrong thing for an injury can cause more damage. The help that is given immediately after someone has been hurt is called first aid. Bold word. Words in italic. Must be important. I should write it down. It helps to make the injured person more comfortable. It can also prevent infection. If given immediately, first aid may save a person's life. Until you are older, you will not be able to do much to help someone with a serious injury. But you can get help quickly. 911 is the number to call for an emergency. Again, bold numbers and italic words. Find someone with a telephone who can quickly call for help. There are some injuries that you can learn to take care of. Minor injuries are injuries that do not require immediate visit to the doctor or immediate doctor's visit. A minor injury that is not cared for probably can be a serious injury if it becomes infected. And here it says, learn the signs of infection. The skin around the wound becomes red and tender. There may be swelling around the wound. Sometimes pus forms in the wound. For minor injuries, RICE, RICE, rest, ice, compress, elevate. Minor injuries, bump and twist are minor injuries. If you were to fall and twist your ankle or bump your leg, you should be able to care for it at home without having to see a doctor. For a bump or a twist, simply rest the hurt area, apply ice, wrap or compress the area, and elevate or raise the hurt area above your heart. For example, if you hurt your ankle, you would lie down and prop your ankle up on pillows so that it would be above your heart. When blood flows away from the ankle, the swelling will go down. Applying ice also helps reduce swelling. It is important that you rest the hurt area and give it time to heal. If you don't have space. If you do not, you will end up causing the injury to get worse. Small scrapes and cuts are also minor injuries. If you wound If your wound is big or bleeding heavily, find a trusted adult or call 911. For small scrapes and clean cuts, clean the area with soap and water. Hold a clean cloth tightly above the injury. And raise it above your heart. This will help the bleeding to stop. Do you keep checking to see if the bleeding has stopped? Do not keep checking to see if the bleeding has stopped. This will cause it to start again. Why? Because it clogs up, right? Our body has the ability to clog the blood. So if you have it wrapped, the body would do what it's supposed to do and start clotting the wound. And if you're lifting that Band-Aid up, every time you lift it up, you take that clog off. So then it starts bleeding again. So you just need to leave it there until at least the next day or a couple of hours. Once you believe that the bleeding has stopped, wet the cloth and gently pull it off. Use a bandage over it, over the injury, and prevent infection. And you prevent infection with soap and water. Most cell phones are locked with a password to keep unwanted people out. But what happens when you need a 911 call and the phone is locked? On most smartphones, there's an emergency button on the screen where the owner would put in the password. Simply press the emergency button and call 911. So at the bottom it says emergency. Emergencies. A first aid emergency requires immediate help from a doctor. Bold letters, italic words. Have you ever been playing outside when a friend fell off a slide or something tall? If you think he might have injured his head or neck or broken a bone, do not move him or try to help him up. Step back and see if he gets up on his own. If he does not, find an adult and call 911. A seizure can cause someone to lose control of his body. The person may fall on the ground and his arms and legs may move. If this happens, remove anything near the person so he does not hurt himself. If possible, put something underneath his head. Sometimes they're banging their head against the floor. So put something soft under their head. If you have nothing soft, put yourself under their head. Like put your leg under or your hand underneath, or that way they don't fracture their skull. Okay, moving on. A jacket, you could take off your jacket, or maybe a t-shirt. If you have for girls, if you have two t-shirts up, you take the top one off, and you could do that. Okay, so be resourceful. The Bible says, I will say of the Lord, He is my refuge and my fortress, my God. In Him I will trust. Psalms 91 verse 2. Choking is another first aid emergency. When someone is choking, he is not able to breathe, talk, or cough. So that means that if there's coughing, he's not choking. Don't give him the Heimlich maneuver. Okay, there's no sound. If there's no sound, no coughing, nothing at all, that means that there's no air. That means that they're not breathing. That's when you do this. Okay, when someone is choking, he is not able to breathe, talk, or cough. If this happens, find an adult and call 911. The adult will stand behind the choking person and wrap his hands around the person's waist while making a fist right at the person's belly button. He then will pull in and up, forcing whatever the person was choking on to come out. If that does not work, the adult may have the person lean over and hit the person's back very hard to help the item move and come out. This is called the Heimlich maneuver. The Heimlich maneuver should never be done on someone who is not choking. How you know is not choking? Because they're making sound. If there's sound, there's air. It is only for a first aid emergency. Now, this is telling you that you need to do an adult, that you need to get an adult in order to do it. But I am of the belief that you are capable. God has equipped us. And even the Bible says, do not make others shame you for your age. So I know that there are certain things appropriate for certain age groups. But here we're talking about life and death. And if there's nobody close by, and you're the only one there, it's on you. So you need to react. You need to know what to do. Remember, I always tell you, you need to be aware of the world around you and how you are affecting that world. You can now walk around the world doing whatever pleases you and not being aware of the effects that you are causing around you. So when you see something, you do something, even if especially when you see it in you, right? Okay, moving on. Electrical shock. Electrical shock is a first aid emergency that is caused by electricity. You have probably been told not to play outside during a thunderstorm. You should also be careful when using electrical devices near water or plugging them into electrical outlets. Following these warnings will keep you safe from an electrical shock. When someone has an electrical shock, it is important to remember not to touch the person. Why? Because if they have electricity going through their body, they are a conductor of electricity. We learned that at the beginning of the school year. There's different sources of energy. So, electricity travels through different material. Humans are conductors of electricity, meaning that electricity travels through us. So if a person is being electrically shocked and we touch them, we're going to be shocked as well. When you're outside, about lightning. If you're outside and there's lightning, if you're in the pool, get out of the pool. If you're close to water, get away from the water. Do not stand underneath a tree. If you're in an open field, sit down. If there are no coverings and you're just in an open field, catches you that you're in an open field and there's nowhere to take shelter, lay flat or sit down. Why? Because lightning is attracted by something standing. So if you're in an open field and you're the tallest thing in that open field, where is the lightning going to strike? On you. And people have been struck by lightning. So it is possible. If you're standing in wet, move away. The best thing to do is to go inside. When someone is unconscious, whether he is breathing or not, it is a first aid emergency. The first thing to do is find an adult and call 911. If the person is breathing, stay with him until help arrives. If the person is not breathing, an adult should start CPR. CPR is necessary to keep the person's heart breathing until help arrives. During CPR, an adult would put his hands together, one on top of the other, and push hard and fast in the middle of the person's chest until help arrives. CPR is for first aid emergencies only. You should never practice CPR on a friend. When we have all of the teachers here at school, we have to be trained in CPR. When they train us, they bring dummies so we could practice on the dummies. And they bring dummies that are the size of an adult, and they also bring dummies that are the size of babies and the size of children. That way we can practice on different size people. But we do not do it on each other. First aid is meant to help people in need. When a first aid situation happens, the most important thing to remember are to stay calm, find help, call 911. Ask God to help the injured person and those providing help. God is our refuge and strength and very present help in trouble. A very present help in trouble. Psalms 46:1. Here are your comprehension check. Answer your questions. Study. Do your test tomorrow. Bye. See you later at the meet. Be ready with your book.